I'm Dr. Nick Merrifield. I'm a GP at Homewood Corner Surgery in New Malden, and I'm going to be talking firstly about cervical cancer and screening. So the first thing is to describe where the cervix is. So it's the top of the vagina, at the neck of the womb or uterus, and cervical cancer is something which it results from cancer of that part of the body. Now, when I was a much younger man, I spent a number of months working in sub-Saharan Africa. And it may be interesting for you listening in that cervical cancer is the #1 cause of cancer death in sub-Saharan Africa. So, and it's very sad. The women are getting cervical cancer and dying in their 30s. Some of us may remember Jade Goody. She died aged 27 of cervical cancer. These are all really are preventable deaths, and it's very, very sad that this still happens. But deaths from cervical cancer are really much, much rarer in westernized countries because of screening. So what are the symptoms? I'll describe that first. So the first thing is vaginal bleeding. So unusual bleeding on or after intercourse, very big changes to your menstrual cycles, or bleeding when you're not expecting it, bleeding after you've had your menopause, so post-menopausal bleeding, changes to any vaginal discharge, pain during sex, but also pain in your low back or pelvis or in the tummy in a pattern that maybe you're not used to, you're not familiar with. So next slide. So screening. So that cervical screening, or having a smear, as it's sometimes called, starts when you're 24 and a half, so under 25, up to the age of 65. So from 24 and a half to age 50, you will be invited to have a smear or a cervical screen every 3 years. And GPs tend to be doing that by text or letter or sometimes phone call. But text is the commonest thing, that you'll be informed that your smear will be due, and then you'll be invited to come along and see the nurse. As you get a bit older, it becomes every 5 years, and over 65, the screening program finishes, other than for people who've had an abnormal test or they're in another specific kind of position. Now, many women on the call will have had a cervical screen or a smear. It's something which is done at the doctor's surgery, generally by a nurse, and it's something which you can ask for a female member of staff. You can have somebody with you if you'd rather. Women who are postmenopausal can find this uncomfortable, so sometimes we use estrogen, vaginal estrogen cream beforehand, which can make the procedure more comfortable. So what results do we get from these smears? So these are the sort of possible outcomes. So sometimes we have what's called inadequate screens. They don't get enough information from the smear. It hasn't worked properly. It's unusual, but it does happen. And if that happens, you'll be invited to come back and have another one. It's about 3 months. What the test actually does is look for a specific sort of virus, HPV, human papilloma virus. And if that is found, a specific sort of higher risk HPV virus, but you have no, then they look for abnormal cells on this little smear. And if they find you are positive for the HPV, but no cells, they would generally repeat this in a year. So they would invite you to come back after 1 year rather than 3 or 5. If you've got both this positive HPV finding and some abnormal cells, then you'll be referred for what's called a colposcopy. Colposcopy is a bit like a smear, but it's done in a hospital. It's when they have a special little tube, which means that the lining of the cervix can be looked at in a very detailed way to see whether you may have a high risk of picking up precancerous cells. So a smear really is a test for pre-cancer, for people who've got a higher risk, who we then can monitor over time to prevent it becoming cancer, of course. Just one thing on HPV. HPV is the cause of nearly all cervical cancer, and we've been doing vaccinations of HPV in our 12 and 13-year-olds for a number of years. So girls started having an HPV vaccine in 2008 and boys in 2019. So over time, we are hoping that the already low numbers of cervical cancer will be even lower. But just to remember, this is as compared to some parts of the world that have no screening, in which cervical cancer is sadly very common and is indeed the #1 cause of death in those areas. So it's something really which shows how powerful screening can be, and it shows how we can really prevent cancer, which is the name of the game for the whole webinar this evening.